The title of this talk is Somatic and Visceral Nervous Systems. We can divide the nervous system in somatic and autonomic systems. Each of these systems has an efferent or motor arm and an afferent or sensory arm. We are going to use the term somatic motor system to refer to neurons and neurites involved in direct voluntary control of movement by muscles derived from the paraxial mesoderm. These include those muscles arising from the general somite, that is, limbs and trunk muscles, those derived from occipital somite, tongue and laryngeal muscles, those derived from unsegmented paraxial branchial mesoderm, middle ear muscles, and muscles of expression and mastication, as well as laryngeal and pharyngeal muscles. These muscles are often referred to as branchial arch muscles. And for some authors, the sternocleidomastoid and trapezius are in this group. Those derive from paraaxial head mesoderm and precordial head mesoderm, the extraocular muscles. The middle ear muscles cast a shadow on the use of voluntary control to define the motor arm of the somatic system, because neither the tensor tympani muscle nor the stapedius muscle are under voluntary control. Yet, we will consider them somatic system muscles. Here, I have introduced a transverse histological specimen of a paraaxial mesoderm-derived muscle. Notice the polygonal shape of the muscle fibers, the position of the nuclei at the periphery of the muscle fibers, and the thinness of the space between the fibers. In this longitudinal specimen, you can better appreciate the multinuclearity and the peripheral location of the nuclei in the muscle fibers, the thin continuous spaces between the muscle fibers, but most clearly their striation. We must acknowledge that in addition to the muscle fibers previously mentioned, called extrafusal muscle fibers, paraxial mesoderm-derived muscles include intrafusal muscle fibers, indicated here in this longitudinal muscle specimen, and here in a transverse cut specimen. And yet we will not consider these fibers during this talk as part of the motor arm of the somatic system. Neither are we to include in our discussion of the motor arm of the somatic system the many central nervous system centers involved in adjusting voluntary movements, which I have signaled by an asterisk in this frame. So in this talk, we will limit the term motor arm of the somatic system to two neurons and the aforementioned muscle type. The first of these neurons is in the motor cortex and surrounding cortices. This neuron is called the upper or superior motor neuron. The axons of these neurons form the pyramidal tract. The second neuron is either in the brainstem motor nuclei of striated muscles or in the anterior horn of the spinal cord. The second neuron is called the lower or inferior motor neuron. The axons of these neurons contribute to the formation of the roots, plexi, and nerves of the face and head, arms, trunk, and legs. The axons of the second neuron are heavily myelinated. Using the axonal motor fiber classification, they are classified as alpha or beta motor fibers. Using a more general classification, they are classified as A-alpha or 1A fibers. They have a diameter ranging from 12 to 20 microns and conduct at a speed of 70 to 120 meters per second, which corresponds to a speed ranging from 156 to 268 miles per hour. As previously stated, these axons terminate in extrafusal striated muscle fibers. These muscle fibers are under voluntary control except for the middle ear muscle fibers, the stapedius and the tensor tympani, as we previously stated. Now let's look at the autonomic system, starting with the motor arm. The motor or effector arm of the autonomic system consists of all neurons and neurites destined to innervate 5 groups of cells, and the neurons and neurites in direct contact with these cells. The first group of cells we are using to define the autonomic motor system is constituted by the smooth muscles. These include muscles in blood vessels, gastrointestinal tract, genitourinary tract, uterus, muscle of Mueller, intrinsic eye muscles, and the often forgotten erector pili. The second group is constituted by cardiac muscles. Cardiac muscles are distinguished from striated muscle by the lack of obvious striations and by the presence of large discontinuous spaces between fibers and intercalated discs. The third group of cells we are using to define the autonomic motor system are the pacemaker cells. The pacemaker cells are found in the heart, in the sinoatrial and AV nodes. Pacemaker cells are also found in the gastrointestinal system, at the Auerbach myenteric plexus, between the outer, longitudinal, and inner, circular, internal muscle layer. The fourth group of cells innervated by the motor arm of the autonomic system are glandular cells. Glandular cells innervated by the motor arm of the autonomic system are myoepithelial, acinar, and ductal cells. The acinar and ductal cells are in charge of producing secretions in the lacrimal, salivary, and mucous membrane glands, and also in the GI tract and pancreas. The last group of cells innervated by the motor arm of the autonomic system, they are the chromaffin cells of the suprarenal medullary region. The neuronal system innervating the previously mentioned cells, the motor arm of the autonomic system cells. First neuron has traditionally been located in the hypothalamus, the second neuron either in the brainstem or in the lateral or intermediate horn of the spinal cord. The axons of these neurons are thinly myelinated. They are labeled B fibers. They have a diameter of 1 to 3 microns and conduct at a speed of 5 to 15 meters per second. These axons are referred to as preganglionic because the neuron they innervate, that is the third autonomic motor neuron, is in autonomic ganglia present in the head and trunk. The axons of the neurons in these ganglia are called postganglionic fibers. The postganglionic fibers are unmyelinated. They are labeled C or Roman number 4 fibers. They have a diameter of 0.2 to 1.5 micron and conduct at a speed of 0.5 to 2.5 meters per second. These axons and the preganglionic axons constitute nerves going to internal organs. I like to make one last general point about postganglionic axons. This point is that they innervate smooth and cardiac muscles, glandular cells, and pacemaker cells. Notice that I have not mentioned chromaffin cells despite having used them to define the motor arm of the autonomic system before. You will see why I have not mentioned them here in a few minutes. So now let's go back to the motor arm of the autonomic system, because as you know, the motor autonomic system is further divided in two systems. In the next few minutes, I will talk about each of them individually. We will start with the parasympathetic system. The first neuron of the parasympathetic system is in the posterior region of the hypothalamus. Their axons constitute the dorsal longitudinal fascicle or fasciculus of Schultz. The second neuron is either in the brainstem, in the Edinger-Westphal nucleus, lacrimal nucleus, salivary nuclei, dorsal nucleus of the vagus, and in part of the nucleus ambiguus. They can also be in the lateral or intermediate horn of the sacral spinal cord. Their axons usually travel for a long distance, or at least a relative long distance, to reach the third neuron in a parasympathetic autonomic ganglia close to or embedded in the superficial layer of the intended organs, here represented as cream-colored dots. The axons of the third parasympathetic motor neuron are therefore considered short. Those axons are only present in the nerves going towards internal organs. They do not appear to contribute to the innervation of the skin nor of the vessels supplying facial, limbs, or trunk-striated muscle, joints, or bones. Before moving off the parasympathetic system, I would like to show you this illustration that provides an overall view of the parasympathetic system. Notice the color of the axons. The red lines represent the axons of the second neuron with their long or relatively long trajectory. The green dots represent the body of the third parasympathetic neurons, and the green lines the axons of the third neuron, which are very short or relatively short. Notice that for cranial organs, the parasympathetic ganglia form isolated structures away from but rather close to their target organs. These isolated structures are the pterygopalatine, ciliary, submandibular, and otic ganglia, whereas for the neck, chest, abdomen, and pelvic organs, the parasympathetic ganglia are adjacent or embedded in the superficial layer of the intended organs. It is worth mentioning that the pelvic nerves are often referred to as the pelvic splanchnic nerves. The use of a splanchnic nerve for parasympathetic axons breaks a rule which we will divulge in a few minutes. Now, we are going to talk about the second division of the motor autonomic system. The second division of the autonomic system, as presented in this talk, is the sympathetic system. The first neuron of the sympathetic system is in the anterior region of the hypothalamus. The axons of these neurons probably initially travel in the medial longitudinal bundle in the diencephalon, and then in the descending sympathetic tract in the brainstem and spine to reach the second neuron. The second neuron is in the lateral or intermediate horn of the thoracic and upper lumbar spinal cord. The axons of these neurons are very interesting. They are referred to as preganglionic fibers. There are 4 types of preganglionic axons based on their trajectory and destinations. You can see in this illustration the 4 types of preganglionic axons. Type 1 preganglionic sympathetic axons are those that innervate the third neuron in the paravertebral ganglia at the same level of their origin in the intermediate horn. For example, an axon arising from a neuron at the T4 intermediate horn ends at the T4 paravertebral ganglion. Type 2, those that innervate the third neuron in the paravertebral ganglia above or below the level of their origin in the intermediate horn. These axons form the interganglionic structure of the sympathetic chain, the cord, and extend rostally and caudally beyond the level of the intermediate horns in the spinal cord, thus forming the cervical and caudal extensions of the sympathetic chain with their associated ganglia. The third type are those that bypass the paravertebral ganglion to innervate the third neuron in the prevertebral ganglion, and the fourth type, those that bypass the paravertebral ganglion and the prevertebral ganglion to innervate the chromaffin cells in the medullary section of the suprarenal gland. As a general rule applied to nerves in the abdominal pelvic cavity, the stretch of axons between the paravertebral and prevertebral ganglia form the splanchnic nerves, whereas axons from the third neuron, not shown here, form plexi. This rule, as all rules, has exceptions. One of them is the following: from the prevertebral ganglia to the suprarenal is also considered a splanchnic nerve. Now let's look at the third sympathetic neuron. Unlike the second sympathetic neuron that has other soma in the same anatomical location, the lateral or intermediate horn of the spinal cord, the third sympathetic neuron soma can either be in the paravertebral ganglia of the sympathetic chain or in the prevertebral or mesenteric ganglia. In addition, the suprarenal medulla houses the chromaffin cells, which are considered by some anatomists to be a modified third neuron, and by others an endocrine cell, because they secrete mainly epinephrine, but also norepinephrine directly into the blood. Of the undeniable third neurons, we will first address the third sympathetic neuron housed in the paravertebral ganglia. All paravertebral ganglia's neurons are in the sympathetic vertebral chain, as you can see here, represented by the little black dots. Some of these neurons are in ganglia corresponding to the level of the intermediate horn column in the spinal cord. Some in the cervical extension are above it, and some in the caudal extension below it. These neurons innervate the skin and the vessels of the skin, muscle and bones. Hence, they are present in the peripheral nerves, going to the face, trunk, and limbs. In addition, those in the cervical extension and upper thoracic ganglia supply the eye and lacrimal glands, the salivary glands, the heart, and the respiratory system. And those from the caudal extension, the distal column and rectum, genitourinary system, genitalia, and the reproductive system. Notice that in this diagram, the lumbar splanchnic nerve is made of postganglionic axons of neurons housed in the paravertebral ganglion in the sympathetic chain. This is an exception to the rule of a splenic nerve being constituted by preganglionic axons. The lumbar splenic nerve is often called the sacral splenic nerve. The prevertebral ganglia is the second possible location for the third sympathetic neurons. Neurons in the prevertebral or mesenteric ganglia innervate abdominal and pelvic organs. The number of prevertebral ganglia varies significantly in different individuals. In this frame, you can see two different versions. In this version, we are presenting three mesenteric ganglia: the celiac, superior mesenteric, and inferior mesenteric. Please stop the video if you have to and identify the structures they innervate. These ganglia are supplied by the greater, lesser, and least splenic nerves. In this second version, in addition to the three previously mentioned ganglia and splenic nerves, we are representing the pelvic ganglion and the lumbar splenic nerve. Notice that in this version, the lumbar splenic nerve is made of preganglionic axons, as is usually the rule. It is also worth mentioning that there is another version of prevertebral ganglia anatomy that adds the aortorenal and renal ganglia to this arrangement. In this version, these ganglia innervate the urinary system. Before leaving the subject of the motor arm of the autonomic system, I like to mention two important points. The first one is that whereas in the parasympathetic motor division, there is a divergence factor of roughly 1 to 4, that is, one preganglionic axon contacts 4 preganglionic neurons. In the sympathetic division, the divergence factor is up to 1 to 20. Hence, parasympathetic actions are more localized than sympathetic actions. The second point I want to bring up relates to the functioning of the sympathetic and parasympathetic systems. As stated in this frame, the motor arms of the parasympathetic and sympathetic system work together, one or the other predominating at different times depending on the biological needs of the organism. Please stop the video again and take a few minutes to read the effects of the parasympathetic and sympathetic systems in the structures listed. The last point I want to make before leaving the subject of the motor arm of the autonomic system is to mention the enteric system. For many years, the enteric system was considered part of the autonomic system because of the complex interaction between the autonomic system and the guts. Yet currently, most anatomic textbooks I have read consider the enteric system as an independent system. The reason for this change is that even if the guts is surgically deprived of sympathetic and parasympathetic innervation, the network of intrinsic neurons and ganglia located in the wall are able to perform their activity independently. In this talk, for descriptive reasons, we have integrated the enteric system in the discussion of the autonomic system. Now, I'd like to shift our attention back to the somatic system to address the sensory component, which we will restrict to include the structures conveying sensory information from the skin, muscles, and joints to the brain. Using this definition, the system starts with somatic receptors, which can be encapsulated, non-encapsulated, or free nerve endings. Stimulation of these sensors, which in the case of free nerve endings are just the distalmost region of the distal axon, excites the first neuron, located at the dorsal root ganglia, at one of the cranial somatic ganglia, or at the mesencephalic nucleus of the trigeminal nerve, which is the only time a first somatic neuron is housed in the central nervous system. The proximal projection of the first neurons make contact with the second neuron located either at the spinal cord, at the dorsal horns, or at the brainstem. In the brainstem, these neurons are at the gracilis and cuneatus nuclei, spinal trigeminal sensory nucleus, or at the main nucleus of the trigeminal nerve. The axon of the neurons at the spinal cord cross to the opposite side and ascend in the lateral columns. The axons of the neurons in the brainstem, at least most of them, cross to the opposite side too. The spinal and brainstem second neurons do so to make contact with the third neuron at the thalamus. The axons from the third neuron make contact with a fourth neuron at the sensory cortex. Now please turn your attention to the autonomic motor system to talk about its sensory component. The sensory autonomic component differs from the autonomic motor component and from the sensory somatic component in significant ways. Unlike in the autonomic motor component, the distinction between sympathetic and parasympathetic elements are not well established. Yet, some anatomists believe that visceral pain is mainly carried by sympathetic fibers, except for pain from some pelvic viscera that are carried by pelvic parasympathetic nerves, and that signals associated to reflexes control of visceral activity is carried by parasympathetic fibers. The difference between the autonomic and the somatic sensory component relates to the difference between the certainty regarding the location of neurons and their trajectory in the somatic sensory system and the uncertainty regarding the location of neurons and the trajectory of the afferent axons in the autonomic sensory system. The most widely accepted description of the autonomic sensory system, according to my readings, relate as follows. Autonomic receptors, mainly consisting of free nerve ending, baroreceptors, and chemoreceptors, make contact with or are part of the first neuron. The first neuron is at the dorsal root ganglia or at the same sensory cranial nerve ganglia as those of the somatic sensory system. The second neuron is either in the spinal cord, slightly dorsal to the autonomic motor neurons, or at the brainstem. In the brainstem, the second neurons are at the nucleus solitarius, the hub of many vital reflexes. The third neuron is likely to be in the reticular region of the thalamus, and the fourth neuron at the limbic cortex or at the insular cortex. Thank you very much for your attention.